Here we go. And this 4-course webinar is sponsored and organized by the Canadian Animal Health Surveillance System. We did do a quick presentation on CAS last week, so I'm just going to skip through that today. Our website is cahss.ca if you want to learn more about what we do, our 7 species network groups, as well as our 2 special topics networks. We also have a smallholder page with a lot of good resources if you are a veterinarian or vet technician supporting small pigs or small flocks in Canada. We do have a lot of good podcasts and resources on our website, so feel free to check that out. I just wanted to remind everyone to mute yourselves during Sue's talk. We'll have a chance to do a Q&A for 10 to 15 minutes at the end of her session, but feel free to chat your questions during her presentation in the chat box. And Sue, are we doing a quick bio break in the middle of the session as well for this one?
Sure, we can. This one isn't quite as long as last week. I didn't actually insert a bio break, but I'll try and remember. And if I don't, somebody can yell at me.
Okay, see how it goes. All right, that's great. So we can take it away, Sue. Thanks.
Okay, let me get my screen up here, and here we go. So I have to apologize for last week because I didn't have my course outline. All right, how do I get rid of this thing? There we are, minimize. I didn't, somehow I managed to make a slide go away, but I'm pretty good at that. Every year as I get tinkering with these presentations. And so in case you were wondering what sort of grab bag of topics we're talking about, and I know Doris had them outlined in the email, but so we did the normal pig already. We're going to do today's approach to the sick pig, and then next week is procedures and disease control and prevention, a little bit of meds and supplies, and then the last bang up session is on pet pigs. So this is always the challenge, approach to the sick pig or the sick herd. And, you know, the longer you are involved with swine and going forward, some things will be more easily diagnosed than others. And I'm almost at the point in my career where many things seem to resemble each other. And I am relying more and more on really good diagnostics from the lab. And I think that's a really good approach. But when you're looking at, you know, you're being called into a situation where there's animals that are not thriving, you know, certainly be mindful of being biosecure, you know, that you have appropriate PPE. I like to do the 20,000 meter observation. So you want to look at the entire operation from a distance, really, as you're driving in, you know, as you're going towards the parking area, as you're going into the barn, you know, you're looking at a lot of things, and it tells you about a lot about the management of the livestock often, you know, observing the environment, you know, is it a fairly tidy operation, or is there a lot of junk lying around and, you know, rats and rodents running? Have seen that myself. So you know, you start thinking about what sort of diseases these things might bring to cause problems, and we'll get into that. And then, you know, after we wander through the environment, we go looking at the group themselves and seeing what behaviors they're exhibiting and what the smallholder is telling you, and then, you know, down to the individual, because many times smallholders already won't have that many pigs, so it's much more easily to do an individual assessment on the pig. So you know, when you're getting into smallholder production, and it's the same as with commercial swine production, you know, you have to be thinking about if they call you and they say, I have these things going on, whatever they might be. And so even on the phone before you go out, you know, you might want to ask a few questions, kind of get an idea of what they're worrying about or what's causing them concern. You know, certainly, is there an emergency? I mean, especially in the evening, like, do you really need to go out there tonight? Or is it something so weird that you should go out there tonight? When they're talking about the pigs, you know, sort of what category does the presenting complaint fall into? What systems? You got any ideas in a differential diagnosis? You know, this era of the iPhone is so amazing. I mean, some of you may nod and smile, or some of you may think I'm a complete dinosaur, and I don't mind telling you I am. But, you know, years ago, I used to drive around with textbooks in my truck and then stop on the side of a road and look things up. And now with the advent of, you know, the internet and data, and it's just fabulous being able to look things up in a heartbeat. Really enjoy that part. So get some differential diagnosis, and it's going to sort of shape you as far as, what are you going to be looking for when they're talking about these problems. But don't exclude that 20,000 meter view. You want to put it all together as a package, and look at that package, and and then that will drive, sort of maybe think about what samples you might be taking, what tests might be helpful, and maybe any other considerations. So we talked about this last week. And I love Shrek, and I don't know how many times I've watched that movie when the kids were small and even now. And, one of the biggest lines with Shrek was certainly, he's an onion, or ogres are like onions, they many layers. And it's perfect for swine medicine because it's many, many layers. I think everything in vet medicine is many layers myself. That's where I've gotten to now. So we have a population approach, and we assess various parameters that influence health and production. Environment and management are often the biggest disease influencers. And I said that last week. The longer I go on, the more, these bugs are there. But I don't really go from A, the problem, to B, the bug. I like to open up all the layers in between and see how management or environment or anything else can be influencing the picture that I'm seeing. And so then we start peeling through the layers. Okay. Come on now, let's go. So, whoa, this is a busy slide. But this is just, to give you sort of your thought process. You can, print this off and stick it somewhere to, make a check sheet of questions you want to ask when you go to smallholders, So you want to ask about, if they say, well, I've got, a sick pig or sick pigs, are they the only ones? Is it the only one of the litter or the group? Are there others affected? What size are these pigs? What age are these pigs? How are the pigs in the neighboring pens? How's the sow? Vaccinations, is there any history of vaccinations? Or if they brought new pigs in, was there any history of vaccinations? Feed, that's always huge. What are they feeding? Is it sort of some homegrown, homemade ground feed? Some people I was at talking about the smallholder last week, and they were with heritage pigs, and they were feeding basically corn and peppers. And so, is that appropriate? Well, what kind of pigs am I dealing with? So you have to sort of peel that onion. Is it heritage? Is it a commercial pig? What are the requirements? How are they feeding everybody? How's the water or feed consumption? Like, what are they, not only what are they feeding, how are the pigs eating? How's the water's consumption? What is the water source? Too many situations in my career where, pond water is the source of water. And you think about what ducks and geese do in ponds, will certainly give you an idea of, if you don't have some kind of a treatment mechanism, that this isn't exactly the best thing, I think, for pigs to be ingesting. And really going sideways, because I love to tell stories. So let's get into a story. So for the Canadian Pork Excellence Program, which is an audit program for commercial farms shipping to federal plants, they have to take water samples once a year, and there's a limit for E. coli in water. So I went to this one farm, and he'd been having dreadful issues with pigs dying, all different sizes. It wasn't adding up in my head, and I really couldn't put it together. And so we got a water bottle that he'd saved for this program, and we were going to test the water anyway. Now was more than likely the time we should do this, because I wasn't connecting dots. And I said, maybe we should take a water sample, because the herd manager had said, yeah, we're on pond water. And that really got my radar out. And so I said, well, where does this pond go to? Well, it goes to a cistern by the barn, and the cistern's in the ground. And I said, are you chlorinating this water or somehow treating it by chance? And they went, no, our chlorinator broke, and we've been fine ever since. And you can only challenge pigs so much. So instead of having, a total of like 10 coliforms per 100 mil, which is our level for a CPE, and acceptable. And actually, that's pretty rigorous. In Europe, they're 100. This herd was scooting along at 8,500 coliforms per 100 mil. And before I left, and knowing it was untreated pond water, I said, you're going to shock this cistern, put them down some bleach. And within 3 days, the pigs started dying. And within a week, we were chlorinating the water. So there's a story for you to think about. Going on, is there anything new? Any changes in feed, water, pasture, housing, new pigs coming in? Where do the pigs come from? You know, are they being processed, or are they receiving what they need? The pig's nursing well. And the other thing, and we just sort of touch at this at the end of this today's lecture, is have anybody been ill at this time? As you know, like some conditions are zoonotic. You know, we always worry about things coming from livestock or to us, but we also are quite capable of giving influenza to pigs. Strep and erysipelas are pig problems, but we can be exposed to them either with, you know, working too closely with pigs who have this condition, even mainly autopsies or people that work in slaughter plants, but they can go to people. So you want to, you have a whole raft of questions you can be asking, and you can pick and choose these, I guess, depending on what the situation you think is, but these are pretty much typical of what I want to sort of go and investigate when I'm there. I like the whole picture. Oh, look, there's more questions. Breeds and species, we talked about heritage breeds, ages of affected pigs, how many are sick, how many have died, you know, is there a mortality rising? How big is this herd? Any other species on the farm? Are there chickens there? Are there ducks, geese, llamas, horses, cows, you name it? And are anybody mixing with the pigs? Typically, you'll have smallholder pigs in a barn, and there may be chickens roosting nearby, which we try and discourage, again, because of avian influenza, and the pig quite easily can pick up that virus and turn it around and make it into something new, and that's not a great idea. You want to look at the housing and the shelter. You know, are the pigs out in pasture? Do they have shelter? You know, and so, you know, and what clinical signs, I guess, at the end of the day, how long have they been going on for? Keeping in mind that in the back of our heads, you know, we're always worried, mindful of African swine fever is really big on the radar, but certainly the different vesicular diseases, foot and mouth, swine vesicular diseases. And we'll talk about that actually in a separate session. So work it through. Basically, neoplastic is next to none in my world, but, you know, maybe there's a significant parasitic challenge because they're out in the same pasture all the time or in the same barn. The pens are never cleaned, and there's, you know, a roundworm buildup, but you can easily figure that out. Certainly, people will often tell you, I've seen worms, and then you can take some fecal samples and determine the parasitic load from the egg count. You know, toxicities. You know, pigs are curious creatures. They like to get into things, and but I did hear of a story a few years ago. Another vet told me of cattle. This was actually a cattle story out in pasture, and wound up getting lead poisoning because there was some old batteries dumped on the back, and they had opened up, and they were, you know, tasting and ingesting sort of the stuff inside, and they wound up with some lead poisoning, which is not great. So again, it's a spectrum of questions, and it's really you know, like a lovely onion approach. So you're going to start from the outside and work your way to the inside, and I guess that's the easiest way I can make it. So and you know, for sure, like I said, inquiring regarding what vaccines they're using. They may not be using any, and that's not necessarily a bad thing. But if they are, just have a look and see what they're using, and are they up to date? The vaccines themselves, that is, they're not expired. They don't have old stuff sitting in the fridge. How many times do I go looking in fridges and find, you know, 30-year-old bottles of penicillin? So yeah, you don't want to have that around. And, you know, if you're going to be examining the animals, you need to sort of have a reasonably good idea of their temperatures, 38.7, 39.2, you know, fairly slow respiratory rate in the non-excited pig. If they're excited and screaming and running, they're going to be about 10 times that level. Just out of curiosity, just because you didn't ask, the lifespan of the average commercial pig can be 15 to 20 years. Potbelly pigs, much the same. Neonatal piglet, a little warmer, obviously, and you know, because of its small lung capacity, it's breathing much faster. And so basically, they're all around the 39 for temperature, and depending on the size of the pig, I don't think many people look at respiratory rate, but we do look at the respiratory pattern. Are they breathing normally? Are they puffing? Is there an abdominal lift? Something that might indicate they may have pneumonia. So I'll show you some photos. I mean, this is obviously quite a normal pig, but you know, you're going to have a look at the pig in question or pigs in question. Are they wasting away? Do they have sort of uneven or poorly muscled hindquarters? Are there diarrheic stains on the back? Is there any tail biting going on? Look at the belly. You know, it's really interesting to look at pigs because when they're not eating, we use the expression they gant right out. It's an old farmer's expression, and they develop quite a tucking in of their abdomen behind the rib cage and tucking up, and so that tells you that there's no gut fill, and that tells you that they haven't been eating for at least a day or two. So you want to have a look and see certainly what the belly fill is. You know, look at the feet. A lot of pigs will have overgrown toes, especially the pot bellies. You know, so is that precluding them from getting around in the barn and getting to the feed? So just all kinds of things to look at. And I stuck this slide in there because, you know, this is a PRRS slide, but it could easily be another virus that we dealt with years ago when it first exploded and globally with circle virus. And you would go into barns and you would have, you know, 50–60% of your pigs looked okay, and 30 to 40% were just wasting away in front of you like this. And PRRS, already a nasty PRRS virus, porcine reproductive and respiratory syndrome virus, can, you know, look that way too. And so I, you know, can't really tell them apart unless you do an autopsy and take some samples. We talked about behavior last week. You know, you need to know what normal is in pigs. They're kind of fun because they should be running or playing, or the older pigs will just be sleeping because that's what they do best. Pigs that are really familiarized to humans will come and greet you, wagging their tails. You know, they go to the bathroom, they all vote on where the toilet is in the pen, and that should be where they're going. There isn't diarrheic feces around. They're eating their feed. You know, and the owner will know these pigs quite well because they are smallholders, so they can describe a lot of these behaviors to you and help you kind of get a feeling for what's going on. So the process starting in the bottom is obviously the phone call. And as I said, you know, get a history. The photos are great. I actually I love telemedicine now because, you know, they'll photo or video the pigs and show them to you, and you can get a really good idea of what's going on. Maybe do a little homework, and then you can go out there, and that will prepare you for the farm visit. You know, as far as what samples do you think you need to be taking, you know, and what questions do you have to be asking regarding the herd health plan and biosecurity. They probably don't really have a herd health, but certainly how are they managing things? And then, you know, getting those test results back, calling the client, maybe a follow-up farm visit. A lot of these people really enjoy having a good interactive visit with their vet, you know, before, during, and after the problem. And then obviously preventative medicine is huge. And that's why I like pigs so much, because it's really public health in a sense, but applied to swine and keeping them happy in the process. So examining the individual pig, you know, certainly smaller pigs, and we talked a bit about this last week, you know, never chase a pig because it's never going to be successful. And I remember going out to a farm last summer. What were we doing? We might have been vaccinating them, but anyway, they were really fast little devils. They were about 20 kilos, and they can motor around a pen and make you look like an idiot. So having a pig board is really good, and you can herd them calmly and quietly into a corner, and then just reach over the pig board and usually we grab a hind leg and pick it up quickly and put your hands underneath to support the pig, and you know, you may be able to examine the pig that way. I'm not crazy about a pig snare for examining pigs because the pig screams, which is stressful to the owner. And then secondly, you know, they're going to be really frightened of people or seeing you again. They're going to have a very negative impression of you. Pigs have very long memories. So if you're able to use a pig board and squeeze it into a corner, and it should be able to get a temperature on the pig and have a look at it. So here's a, you know, classic. You might be on a farm like this, and you've just got to get this pig somewhere where you're able to do a reasonable job of having a look at it and seeing what's going on. So, you know, you've been phoned by the client. Maybe you've had some videos. You're kind of, you know, sussing through the problem here a little bit, and you know, what samples and what tests, because it's not the cheapest to send things away, and you can't just have at it, you know, quote unquote whole hog. There's a bad joke. So, we don't really, unlike small animal, we really don't tend to perform like a CBC profile on pigs, simply because the reference values, they're better now, but years ago we didn't have really good reference values for swine. So sometimes you get outliers and they're hard to interpret. I would say that certainly feed analysis is not uncommon in my world by any stretch. Taking blood and spinning it into serum, I may be looking for antibodies or doing PCR work for different viral conditions. So that would be pretty common. Like I said, fecal samples would also be not unheard of. I think that's a good idea. If you're doing postmortems, collecting samples for postmortem, you might be doing histoculture, and we'll talk about what organs are good to use. And viral testing, mercifully, some wonderful person decided that we can use ropes and collect oral fluids from swine for different viruses. I'll talk about that a little bit further into this discussion. But we can also use actually Swiffer wipes have been used for influenza detection. So if you've got something going on you think might be flu, amazingly, you can use a damp Swiffer and you can just wipe along the udder and put it in the bag, squeeze out the juices and send it away, and we can find influenza. Isn't that amazing? I just love how life is getting easier as a pig vet. It's terrific. Bleeding the pig, well, you can use an ear vein. We often use this on potbelly pigs because they're so jowly. They're just darn near impossible to get a really good jugular. I'm actually a jugular vein person. I mean, I did this for years and years and years. I can do it in my sleep. And that's certainly where you do need to restrain the pig in order to collect a sample, either from the ear or the jugular vein. Depending on how much blood you want to get, and if you can guarantee that the pig is going to stay steady on that snare, you can use that vein. They're not that hard to find. Or certainly using the jugular in small pigs, it's great. You just flip them upside down and basically sort of towards the shoulder, the point of the shoulder, you insert your needle and you can hit the jugular. It's pretty nice. You want to keep the pig steady. Like you can see here, it's the pig is positioned in somebody's lap, because they're surprisingly powerful, even a small pig. And if they get tossing their heads back and forth, there's a chance you can lacerate the jugular vein, and that doesn't often have good outcomes if that happens. So you want to be having them, pretty steady. Or if somebody's got, kind of a sling kind of system where you can hold their head up and get at the jugular, if you're comfortable with that, go right ahead. Larger pigs easily bled while standing, either right or left side. I'm ambidextrous. I can do both sides of the pig now. Years ago, I was only a right sider, but now we can do both sides. You see there, they've got a snare on the pig here. If you've forgotten your snare or they don't have a snare, whatever, just a rope will do. You just make a little noose in it, a quick release, and you can snare them on the upper jaw and hold them up, and away you go. But you should be able to get a sample out of that pig once you're experienced. I mean, I can be in and out in about less than 6 seconds. 6 seconds. 5 minutes is like you've been hunting. So it also makes you look not really great, but you got to start somewhere. I did reference oral fluids, and so this has become very popular in swine medicine, thank goodness, because it sure saves you trying to find the jugular vein on pigs. And we can test for a number of organisms with PCR testing on the oral fluids. The only thing I will tell you, it's really not accurate for influenza, but I told you about the Swiffer on the sow udder, or you can do nasal swabs on pigs and look for influenza that way, because they certainly will have a nice nasal discharge, and you just use your nasal swabs or viral swabs and collect that way. So I noticed that last year I forgot to put in that you must only use cotton ropes. Hemp or polyester aren't really good sampling ropes because it may inactivate the virus or interfere with the testing. So you just get a section of rope. I usually get the tri-ply braided cotton rope, or not braided, twisted cotton rope. I ordered through Amazon. It's surprising how the prices are all over the place. But at any rate, I cut off maybe a 6-foot section. I unwind it because I'm cheap, and you all don't need the whole 3-ply. You only need one of them. So see, you can get 3 tests out of 1 rope. And the fun thing is not just testing one pig, but you can test the group. What you're doing with this is a group test to determine what's going on. So if you had a pile of pigs, you get called out, somebody's got, 20 pigs they're raising for market. And like the call I got this morning, I got thumping pigs, I got a nasal discharge. They're not feeling really good. We just brought some new pigs in last week, and I'm like, it's flu season for pigs. And so, but you want to rule out, other things like PRRS and mycoplasma, so we can do rope testing. And then, like I said, I did my nasal swabs, and we'll find out what we're dealing with, but I'm pretty sure what I've got. So tie the rope over the pens. Pigs think they're marvelous toys, and they're all going to chew and fight, and give them about 15 minutes. And then you just collect the ropes and hold the dry end with one hand and put the wet end into a plastic bag, and then squeeze all the juice out that you can, and then put it into a tube and send it to the lab. So there's a reference there for University of Minnesota, and they'll show you how to do this. Poop samples often are revealing, not just for parasites, but there's other bacterial infections of swine. Again, samples, because we thought we had, and we'll talk about this just a little bit down the road, some ileitis in pigs caused by Lawsonia, kind of a diarrheic kind of thing. I've had a few cases of this lately, and so you just scoop up some poop and get them into a bottle that can be screw capped. I actually put mine. I'm in Ziploc bags, but I double and triple bag it, and then make sure it's in a really secure container. There's no explosions on the way to the lab. And then they can PCR test for what I'm asking for, do cultures and sensitivities. And so you can get a wealth of information from fecal samples if you think you're dealing with something going on in the GI system of the pig. So there'll certainly be pooled samples for the most part, but that's fine. You're doing, that's the beauty of working with swine herds, because it's a group love kind of approach. Don't forget to look at the feed. There'll be stories about this, but I just had a guy look at his ration, and you want to make sure they're balanced rations. If they're making their own feed, they may have their own corn, soybeans. Maybe they've got like a little mini farm with a bunch of different animals, and so they're milling their own feed. And they're just buying the premix, which this is basically the vitamin mineral supplement for pigs. And you want to make sure that they're adding it at the right rate. So this morning, this was a day of stories, I tell you. I've lived a month and a day and a half today. But at any rate, I had a 60 sow farmer. I would consider him a smallholder now. And he'd been struggling with sows that were really lame after weaning their piglets. And some of them were going down, and he had to destroy them in the herd. And then the lameness was kind of on and off and shifting. And then it kind of moved into, they're not farrowing out. I'm forever pulling piglets out. That's not right. And how old is this herd? Do you have a lot of old sows? Because old sows will get uterine inertia. And he went, no, it's like almost across the board. The younger sows, the older sows. And so he reminded me that he was on one premix for all sizes of pigs. He just proportions it differently depending on what he's feeding. And I said, are you sure you're adding the right amount for your sows? Because you want to make sure your calcium phosphorus is in the right proportions. It's higher than for finishing pigs, because sows nurse, and there's a huge demand for calcium. And, if you don't get enough out of your feed, they're going to suck it out of their bones. And when bones get low in calcium, they get microfractures and they get very painful. And I thought, muscle function's probably dysfunctional with maybe not enough calcium, and hard to test for calcium in the serum of pigs. It's hard to interpret, but it's a lot easier to send a feed sample, and we did. And he called me back this morning and said, you were right on the money. We were way under with our calcium phosphorus. We've adjusted the premix. We did that about a month ago, and everybody's coming back on board. So interesting story. But we also get into mycotoxins. So these are toxins that are formed by common plant fungi. And the two big ones that we always look for is zearalenone and vomitoxin. So zearalenone is estrogenic, and it can, and this time of year, I sometimes see it when we get to what we call bottom of the silo syndrome. So just before harvest starts, you're kind of scraping the bottom of the silo, and sometimes there's some ugly stuff sitting around, and there may be some zearalenone contamination from last year's crop. And so it's estrogenic, so it can cause, you can get vulvar swelling in really young gilts, young pigs. May interfere with some breeding, but vomitoxin actually is a really big one we really worry about because it can cause feed refusal. Above 1 part per million and about 2 parts per million is where you get actual vomiting, which is why we call it vomitoxin. So, you know, feed is, you sort of say, well, it's feed, but there's a lot of components in feed that come into play. And so there's that story about, you know, guy didn't do it right and had an issue with his sows. So as I referenced earlier, you know, we can use nasal swabs, you know, or bacterial swabs, you know, store them in the fridge, get them to the lab, depending on what you're chasing in the herd. So have both around. Viral swabs are really cool. I keep them in my PM kit, and every once in a while I have to pull them out. I never really look at the dating on them, but that would be me. And I actually used some earlier on this summer. I had piglets with diarrhea, and I was looking for bacteria as well as viruses. So I did a bacterial swab, and I thought, you know what, I'm going to stuff a viral swab in his little butt and see what I pull out. And I pulled out a whole horde of rotaviruses, which are really notorious for young pig diarrhea. So that was a really easy way to figure it out. Abortions, they can be really tricky to diagnose. You know, you need to know the number of abortions or stillbirths that are happening, and what sort of signs. Is there anything happening, or are they just dumping these pigs out all of a sudden? What age of animal, what stage of gestation, that clues you in, you know. The PRRS virus, porcine reproductive and respiratory syndrome, tends to be the last couple of weeks, just before the pigs are viable, if they hit the ground, and then they'll be born early, and of course their lung development is non-existent, and they'll die. So, you know, you need to have, again, that whole history of how this has been happening. Were there new animals brought in? You know, possibly they brought something in with them. You know, submitting fetuses might help, you know, some histology, and you know, you can do some bacteriology. Again, you have to be mindful of what you're asking for. You just don't want to ask for everything, because it's going to be costly for that smallholder who, you know, doesn't really probably want to spend any more than they have to, like everybody else pretty much. And you can take serum from aborting sows. I've found that to be less useful personally. But, you know, if you have sows that are indoor, outdoor, and we're concerned about leptospirosis and these animals aren't vaccinated, certainly pulling an acute and convalescent may help you to determine if there's something like that going on. Obviously, you know where your local labs are. I'm sure you're all aware. And they will be, we're not going to be screening tests for African swine fever. Why did I put that in there? Clearly not thinking. But anyway, we have different labs in Ontario, and there's a CanSpot ASF program that goes on. So if we are sending some tissues in, specifically spleen, you know, they'll do a testing on it just because we're doing a survey. It won't be charged back, of course, but know who your local lab is and know who your pathologists are, because they're so much fun to talk to and brilliant. I work with a number of them at University of Guelph over the years, and sometimes when you're struggling, you know, working through a case, calling them up and having a discussion and getting their feel on, you know, what should I be sending it? What do you want to see? What are you thinking of? Because they see it all. So in your postmortem kit, you know, we talked about taking samples, and we talked about swabs. You know, have your necropsy kit there, tissue forceps, sharp blunt scissors, hemostats, scalpel handles, formalin jars, post-mortem knife, make sure it's sharp. Lots of specimen containers, blood collection tubes, needles. I think this is pretty, oops, sorry about that. That is my phone going off, which shouldn't be. any rate, blood collections, needles, and have a kit. Mine is packed full of stuff, and I have hopefully everything there that I need, although inevitably I seem to be running out of something. I should have had also in there. I do have scalpel blades. Scalpel blades. I'm always losing my scalpel blades. So make sure you put them. I have actually my necropsy kit is a separate plastic kit with a snap lid. So it's one of those Rubbermaid ones. So I put all my, obviously all my postmortem tools in there that I need. And then all this other stuff sort of rolls around outside of it. So this is a postmortem video, but we actually, Josepha DeLay from the University of Guelph is polishing off a formal how to do a good pig necropsy video, and we are hoping to get it posted, submitted and posted. It's going to be part of OHN, but also we're going to have it as a resource, for this course as well. And I don't think it ever hurts to be reminded as to how to perform a good swine postmortem, and what to look for and what samples to take. In my world, especially because I do some expert witness work, or if you're on a farm where there's been some kind of a toxic incident or something from something being introduced to the pigs, you want to be able to document it properly with a very good postmortem methodology. So we will have that for you guys at some point, and as a reference. I think it's really good to have that. So submitting samples for postmortem, what do I like to send in? Well, depending on what you're dealing with, here we go. It depends. I had a classmate, fabulous guy, he's still at Minnesota, University of Minnesota, John Dean. Like, he is just the soul of pigs, and he knows everything. And his famous answer always when you ask him a question, you're in conference, is, well, it depends. So what are we working with? If you're working with a pig, obviously with, respiratory issues, you want some lung tissue submitted. You might go for the lymph nodes, maybe a sample of trachea. I don't usually remember to do that. Look at the heart if it's looking kind of funky, or if there's sort of like sticky stuff all over it. I call it, if there's some fibrin or adhesions, fibrinous adhesions to the on the outside of the heart, then submit that as well and take some cultures while you're at it. If you're, certainly if you're looking at a pig that's kind of sick all over, there's all kinds of stuff happening, and we think, well, maybe we're dealing with PRRS, certainly lung is going to be really useful, but just in case, you can take liver, you can take spleen. Kidneys were really useful for diagnosing porcine circovirus. Mesenteric lymph nodes, submit some of those. I'll tell you a story. All these things together will tell you a story on what's happening in that pig if we're looking at what's happening. Sample of jejunium or ileum, especially if we're dealing with Lawsonia, which causes diarrhea, so they're useful to have. So I sort of actually got some diagnoses in there as we're going through, and I'm not sure, this might be a good part. It's only been like half an hour plus, but do you guys want to take like a really quick break, and then I can kind of continue the narrative going on through diagnosis? Does that sound good?
Yep, sounds great, Sue.
Take like 3-4 minutes.
Yeah, sounds good.
There we go. Good to go?
Yep, sounds good, Sue.
Okay. All right. Here we go into diagnosis. And again, this is a 20,000 meter view. The book of diseases of swine is, as thick as my computer is wide, and so there's lots of things. So we'll try and make it fairly simple approaching this. So what I looked at, I sort of onioned diagnostics and what do we normally sort of get presented with smallholders. And actually I would tell you many of these would still be presenting complaints for my commercial herd. So lameness, sudden deaths, diarrhea, respiratory issues, itchy pigs, that can be a real big one. Off feed, losing weight, or unthrifty. That's a catch-all there, but that's really common. So let's look at respiratory diseases. And so when you're looking at smallholder pigs production, hopefully you've had some experience with larger producers, but get to know what's normal. A normal pig lung is just a beautiful thing. It's a salmon pink. It sounds weird when I say that, but salmon pink, I love to see lungs like that because I know everything is good. You get a pig on the right there, you've got a lot of coughing in the herd, you get a pig that's really unthrifty, you decide to euthanize it. And, you see that he's got these antero-ventral consolidation in the anterior part of the lungs, and that's pretty classic for mycoplasma. But typically this is also a combination pneumonia, might be this and other things in there too. You might get something really ugly like this big lung down there. Something is wrong with that lung. Look at, the sort of the better lung is behind it, if you can call it that. And this is big and it's hemorrhagic and it's got fibrin on top. And that's a pretty big clue we got a problem. Viral pneumonias, we live in the age of the virus now with livestock, and really common. So you get this sort of speckled, very firm type feeling lung. Feel these lungs, the normal lung should be really nice and spongy, and this lung can be surprisingly firm, and you just wonder how the piggy can even breathe if he's got that much consolidation going on from effects of viruses in there. So, and for diagnostic purposes, going back, take some of those, take samples fresh and histologic samples, and you'll get a pretty good idea from the lab of what's going on, and then you can go forward and manage it. Atrophic rhinitis, we used to think that some of these old swine diseases were gone. Surprise, they're not. And every once in a while, they come back to haunt you. And many times on a smallholder operation. So these bacteria don't read the books, and they don't know they're supposed to be gone. So, having a pig that looks like his nose has been whacked sideways, it hasn't. It's the effect of this Pasteurella, Maltacida, and Bordetella bronchoseptica. They sort of an evil team that destroy the cartilage of the turbinates, and then as the pig grows, his nose distorts, and they actually don't grow really well either, because Pasteurella produces a toxin that goes through the pig and damages kidney function, etc. So kind of a lot of problems. So, if you look down at infectious here, we have, certainly viral causes. I referenced influenza. We have porcine reproductive respiratory syndrome. That's really big on the hit parade and small pigs. Circovirus, not so common, but I wouldn't say that, because it depends on what the smallholder is doing, where they got their pigs, and what the vaccine status is. Mycoplasma, Glasser's disease, Actinobacillus pneumoniae, strep suis, so the bacterial kind of rule outs. Parasitic for sure. If you open that pig up and you had really spotty liver, you're going to immediately start thinking ascarid migration, and severe ascarids, we know it can choke a foal and kill it, but severe ascarids in pigs will cause, sometimes if they come into a barn, say the guy's bought 25 kilo pigs, and if there's a really big load of ascarid eggs, you actually can get a fulminating pneumonia, and a lot of deaths from these eggs all sort of hatching, if you will, at once, and this giant migration of ascarid larvae through the liver and into the lungs, and it's a mess. So wouldn't roll those out, but it's less common for sure. So I would think, more, I'm less on the metabolic, and, certainly environment will compound the pneumonia. So if the temperature's not right, the pigs are cold, or they're not, they don't have enough bedding, or there's enough water as a challenge, or the feeder space. That's going to really compound and escalate pneumonias in pigs, because it's kind of one of their it's their Achilles heels. Their lungs are their Achilles heels, basically. So make sure the environment's good. You can't treat the pig if you don't fix where he's living. If that's part of the problem, fix it. And it's always good and satisfying. You saw some of those really cool pig housing ideas last week. You can put a pig house in a pig house. I've seen people make mini pig houses, not mini pigs, but mini houses for pigs, and put them in the barns, and then they have a microenvironment. How wonderful. The pig can decide where he wants to live. Is a diet balanced? Make sure that's going well, and obviously I'm not going to get into treatments per se. There's lots of good references online, and if those of you that are really keen, you'll pick up diseases of swine, and make sure the environment's good, the appropriate temperature. If the pig has a fever, obviously you're going to want to be using anti-inflammatories, and then also appropriate vaccination where necessary, depending on the size of the smallholder, whether you're going to or not. And judicious use, of antibiotics. Like I said, judicious, that's the big one. Judicious use of antibiotics, always important. The next really big one is certainly neonatal diarrhea. That's pretty simple. They're telling you their pigs are scouring. They've got, stuff running down out of their butts, and they're thin, and they're not, you look at this litter up here, then they might get it, their spines are starting to show. Often they stop nursing as well. And then because they're not nursing, then the sow isn't stimulated to keep producing milk. And then you get into this sort of vortex where, she milks less and they don't get enough and they're not feeling good. And it goes backwards in a heartbeat. So as I said earlier, it might be a rotavirus. If all your piglets are sick at once and everybody's vomiting and they're squirting out the back end, you might have porcine epidemic diarrhea. That's highly contagious. So you want to make sure you don't have porcine epidemic diarrhea. And the only way you're going to determine that is certainly to send samples to the lab. But if everybody is sick, go home and don't see any more pigs. I'm going to tell you that right now. You don't want to carry that stuff around with you. And it's pretty stable at 20 degrees C. So even a lovely day like today, that stuff makes its rounds. Circovirus, not so much in nursing piglets. It affects larger pigs. But bacterially or basic E. coli, they've never gone away yet. They're still out there waiting to cause grief. Clostridium maybe, coccidiosis, which is a protozoal infection, starting around 7-8 days of age. You get that more gooey, sticky, yellow kind of diarrhea. So, and then it's never one thing. I'll pull E. coli's and rotaviruses out, and it's like, we work with them. You work with them. Get a good diagnosis, get the environment, get them warmed up, and get it figured out, and then we can go forward. So there's your different differential diagnoses. I said, viral causes, bacterial causes. In larger pigs, we talked about piglets. Larger pigs, you want to rule out ileitis, which is Lawsonia intercellularis. That's pretty common. That's a big one in our world. Salmonella, maybe not so often, but I guess it depends on the environment and, the presence of other livestock and who's shedding what where. And like I said, parasites. I talked about water. Don't forget about the water source. You challenge a pig, like I said, with a hefty, coliform count in water, and you can't expect it to do really well. So back to neonatal diarrheas. Obviously, we see, pigs, they go backwards, they get hairy coats, they have wet back ends, they become really dehydrated. So the interesting thing about neonatal diarrhea is the diarrhea, the organism itself usually doesn't kill them unless it's a toxigenic E. coli, goes systemic, but really it's dehydration. So it's serious. All diarrhea is serious in baby pigs. They don't have a lot of resources to deal with it. They're still trying to get fat and sassy. So we need to deal with that. And like I said, a PED is pretty classic because everybody's sick. Piglets are vomiting and diarrheic, and they start to die like flies. And if sows also, they may start vomiting or diarrhea. That's really high in my rule out list. So get feces or piglet postmortems and take sections of the gut, evaluate the farrowing area and the creep area. You know, sort of age of piglet will really help you to work with what you're dealing with. E. coli's are like, you know, usually 1 to 5 days, 2 to 4 days, 2 to 4 weeks post weaning would be a post weaning E. coli. We're not really going to address that because we're just going to run out of time here. C. difficile or Clostridium perfringens. I haven't run into that lately, but I'm going to say that, and it's going to show up in the next week. So anyway, you can't tell by looking. A lot of times you need to get samples. You know, preventative measures, you know, make sure piglets have nursed within 12 hours of birth. They've had that colostrum, hugely important to protect those guts. If they are diarrheic, it's just like with calves, you know, give them electrolytes and water. Dehydration kills them, let's rehydrate them. And warm water would be really kind. There's nothing worse than giving a piglet cold water and electrolytes because, you know, cold water slows down gut motility, and we're just going to make things worse in my world. Yeah. Sometimes people will, you know, if there's only a litter or two, they might really be inspired, and you can, you know, kaopectate, you know, or activated charcoal, trying to dry up those guts a little bit. And certainly after they're weaned off and hopefully have survived, cleaning and disinfecting of the farrowing area, and judicious use of antibiotics depending on what you're dealing with. Now, for everybody, if you want to look like a hero, you know, who carries around electrolytes all day long? Well, as a pig vet, I don't, because most people order their stuff and I send it to them. So my truck is fairly light on important things because I never know what I'm supposed to bring, so I don't. This is the WHO rehydration formula. And there's various formulas online. I just pulled this one off. And, you know, if you want, post it, put this in your phone, you know, you go look it up, it's fine. And you can have the client make their own electrolyte solution, because when you're there and these pigs are, you know, say they've got an E. coli and they're scouring their brains out, and so you've decided, okay, I think this is E. coli, we're going to use some antibiotics, just, you know, try and dry this up a little bit. But remember, dehydration kills. So rehydrate with warm water and fill their bowls, change their bowls 3 to 4 times a day, because they'll run for this stuff. They will drink it, but they'll also dance in it, they'll poop in it, and they'll do all kinds of dumb things. And so you really don't want to compound the problem by having, you know, dirty electrolytes. Anyway, tip of the day, and I have carried this recipe with me forever, and it still comes in really handy. Neurologic, not so big. I think in small pigs, the biggest issues would be strep suis, meningitis, maybe Glasser's disease. Post-weaning, I vaguely referenced a post-weaning E. coli. It's called edema disease. It's I don't actually normally see neurologic disease. I just see rafts of dead pigs with swollen eyelids, but that's a whole different phenomenon. But it's quite interesting. You can look that one up. Obviously rabies, but that is pretty rare in pigs. And yeah, salt poisoning, water deprivation, that's huge. If you've got weaned pigs or growing pigs, and you know, the story of we were fixing, this is always classic, get the stories. I was fixing the water line, I turned it off and I forgot to turn it on, and suddenly your pigs have had no water for 5 days if they've got an automatic waterer. And 5 or 6 days, you know, you turn the water on, the pigs go crazy, they start drinking like heck, and their little dehydrated cells in their brains become overhydrated and explode, and now you have a neurologic phenomenon. And that's a very classic story. So another tip of the day is, if the guy's working on the water line, have him tie a ribbon to it so it like hangs in front of his face, or tie a rock to the ribbon so it bangs him in the face to remind them, turn your water back on after you've been working with it. We talked a little bit about reproductive problems and what samples to take. Parvovirus and PRRS would be your big ones for either infertilities or abortions. Leptospirosis, brucella is really not out there. Lepto for sure, if you have rodent issues, and you know, sows are having issues with aborted litters. Infertility would be Leptobratislava as well. So you can, like I said, you can pulse, if they're not vaccinating, you just pulse some blood. It's really easy to find antibodies if they've got lepto. Maybe mycotoxins in feed. So they're a little trickier, but I think, you know, good history would help you where to go with that. Lameness, yeah, you know, lameness. I had a lameness case. Here's a lameness case for you in a commercial herd. Guy's raising his own gilts. He's a big commercial farmer, and he said, all my gilts are lame. Like they're just lame. My feed guy was in, the other diagnostician, and he said, I've got this Mycoplasma hyarinus infection, which, if you want to look it up, causes a lameness and arthritis in growing pigs, and it's subtle, and it's kind of a pain to diagnose as well. So he thinks I should put, all these antibiotics in feed, and I'm like, well, it's only your gilts getting this. It's not your finishing pigs that live in the pens around them. And he went, no, it's just the gilts. And I said, oh my gosh. And so we get talking. And so looked at pen density, and he actually used to have like 30 pigs in a pen, which was fine. He cut it down to 15 because these are expensive replacement animals, and they're still lame. And he said, yeah, and they're beating each other up. And I went, yeah, and they're tripping in the slats, and they're falling over, and they're wrecking their knees. And he said, yeah, he says, because when they get to the finish, so this is the younger pigs. This is like, 25, 30, 40 kilo pigs. And then when they move to the finishing barn, they're already damaged enough that they're not doing well, and they can't make replacement animals. And so this was pretty straightforward. I don't think that you have an infectious problem. I think we just have to get better footing underneath of them. Like we've got to get some toys in there, just distract these pigs, ropes and chains and balls, and have them go after those things rather than beating each other up because they're bored to death. So that's a tip of the day. But in young pigs, these diarrheic pigs, or not diarrheic, but pigs born, if their navel cords get infected, it's really common to get arthritic conditions from a grab bag of environmental organisms, E. coli and staph and streps and things like that. So you get these mixed bacterial infections. Lameness in older pigs, make sure that the feed is balanced. We'll tell a story about that in a second. And, we have this virus out there called Seneca Valley virus, which in and of itself can cause vesicles, although it's not technically reportable. You still call CFIA. And that I'll talk about in the recorded lecture on sort of foreign animal diseases. But, have a look, certainly if there's vesicles on their nose, blisters on their nose, and they're pretty lame, it's like, better call somebody. Nutritional, like I said. So we'll get to that after a couple slides here. Dermatologic diseases, look for sarcoptic mange A, sarcoptic mange B, sarcoptic mange. They are itchy. Zinc deficiency can look like sarcoptic mange with thickened, ugly skin, sort of in the lower legs, but they're not itchy. So it's pretty easy to sort those two out. Bacterial conditions for skin lesions, erysipelas, we get greasy pigs. So there's a pile of stuff. Skin lesions, actually, it's kind of fun in pigs. You probably see more of it in smallholder than you will in commercial herds. Greasy pig comes and goes. It's probably one of the more common skin ailments. You get these gray, fuzzy pigs. It's a staph hyacus, which is actually a common organism on the pig. It can explode, especially if you have young moms, gilts, parity ones with poor colostral protection to the staph. And so the pigs will get fighting, and they'll get wounds opened up on them, and this bacteria will invade and then just spread like wildfire. It starts usually around the head area, face area, and then they get fuzzy because they're cold. So often, if it's not a heritage breed, if you've got a fuzzy pig, he's a cold pig. So he's cold, he's kind of hairy, he's not feeling well. And they also actually, they can dehydrate because the skin integrity has been compromised by infection with this organism. So it's a mess. So it transmitted, like I said, it's there anyway, new stock, it's young pigs with poor colostrum. So rather than injecting them, because it's a staph, so it's resistant to darn near everything, foaming agents. There's some accelerated hydrogen peroxide cleaners like, what's it called? Prevail. And, lift the dead skin and kill the bacteria with that. If you're going to use a foaming agent on the pig, make sure you keep the pig warm after. So heat lamps, thick, deep bedding. You can try antibiotics. I think it's really frustrating. Hydration, give them some electrolyte solution. Healing is slow, but a lot of them come along. And I think if you've got motivated smallholders, they'll really work with these pigs. Needle teeth trimming, it's a routine procedure. A lot of people don't do it in smallholders, but if you find that greasy pig is a situation there's an outbreak, then you sure want to promote that technique to limit the amount of damage they're doing to each other. Other dermatitis conditions, swine pox, gee, that's come back to haunt me. That sort of resurrects once in a while, and you get these funky little lesions on the pig. Kind of look like greasy pig, but they're not. And it's a bigger pig, and he doesn't get hairy and ugly. Dermatitis nephropathy syndrome. Oh gosh, this can look like foreign animal diseases too. And you can diagnose that with a history of not vaccinating for circovirus and a lot of those skinny, yucky pigs out there. And there's not piles of them dying, but that guy did. Pityriasis, which is sort of a fulminating, moving kind of skin lesion. Looks like a fungal infection. It isn't. Goes away in its own. Don't worry about it. So here's just a story about, because I love telling stories. So from years ago, you get the call, my nursery pigs are doing terrible. And that's a photo I took, and I'm sorry, but didn't have the right settings on my camera. You can tell the pig, that red pig in the background, looks dreadful, and everybody's skinny and they're crappy looking, and they're fighting and they're tail biting and they're trying to die, and this producer is losing his mind. His post-weaning mortality, should be 2 to 4%, is up to 10%. This is a commercial herd, but it's a good story. The pigs are not growing, they're losing weight, and of course, you always get called when the producer is deep in the middle of it. This will never fail. Rule of pig medicine. They'll call you when they're deep in the middle of it. So what am I thinking? I'm looking at these pigs and I'm going, well, it could be PRRS, but usually pigs get pneumonia that size and they're not really thumping, which is this abdominal lift I was talking about. Maybe it's circovirus infection, but the pigs were vaccinated. They shouldn't have this many affected. The post-mortem didn't tell me anything. I don't know. And then this guy, he's a great Dutch farmer. So of course he calculates his feed consumption costs prior to the visit, and his feed costs were way up in finishing and way down in the nursery, which is the reverse of what it should be, because the nursery feed's always more expensive. It's higher in protein, and it's usually a more complicated diet. So finishing pigs weren't eating. They were also hyperactive and trying to kill each other. So this whole story is kind of like, why are the finishing pigs cost down? It's the most expensive pig to raise is when it's a finishing pig. So we looked at the feed and we sent samples away. And the nursery feed was at 14% protein, and the finishing pigs were getting 22% protein, which was the reverse of what it should have been. And so what happened was the feed guy the delivery truck had put the wrong feed in the wrong bins. This had gone on long enough that some pigs developed rickets from calcium phosphorus deficiency. Days to market went through the roof. It was really bad. And the reason I'm telling you this story, because when the pigs with rickets got to the plant, I got a phone call saying we want to report this guy to the Animal Welfare Services because we think he's beating his pigs with a shovel and breaking their ribs. And what it really was a manifestation of rickets with, the costochondral junctions are affected and the cartilage, and it was just swollen. So it was just a wild situation. So I always like to tell people, and maybe not the little smallholders, but if you have larger smallholders, keep a feed sample. I like to tell my commercial guys, you should keep 6 weeks worth. Every time you have the bin is filled, you make your own feed, put a sample. So this is a really cool idea I got on one of my trips. And so these jars are numbered for weeks of the year, and every week a sample of pig feed goes in there, and then they can reach back and test the sample if they have to, which I thought was pretty cool. And this was in South Africa. So there's the sow herd, enjoying the open-fronted lifestyle in South Africa, although I will tell you that in the wintertime, the nights get as cold as 0 degrees Celsius. So did you know that elephants can live at 0 degrees Celsius? No, neither did I, but it was interesting to learn these things. As well, keep zoonoses in mind. I don't know how many times anybody else has stabbed themselves with a scalpel blade. I'm forever doing that with postmortems. I'm sure I'm immune to everything, but you want to be mindful of what the pig might have, and you don't want to get it either. So I've been around long enough. I don't think I've, knock on wood, picked anything up from pigs at this point, but you should be mindful, and maybe just wearing a mask when you're doing a postmortem isn't a bad idea after all. The one thing we really want to be aware of, you get the call for really high mortality. Now, like I said earlier, if it's little baby pigs and they're vomiting and they're diarrheic and they're dying, it's probably only going to be porcine epidemic diarrhea. But if we have high mortality, there's things you can think of, maybe feed delivery error. I had a situation where beef feed was pellets was fed to pigs, and it contained monensin, rumensin, and that's toxic to pigs. It's cardiotoxic, so everybody was starting to get sick and dying, but it wasn't acute. So we did figure that out. So look for toxicities, look for nutritional errors, look for lack of water, look at the pigs, look at the, look at the postmortems if you can do a bunch of them, and always have in the back of your mind, is this a foreign animal disease? And one would hope not. But if you're seeing blisters, erosions on the snout, the pigs are really sick, systemic illness, nobody's doing anything, they're all lying around. There's a history of maybe somebody in the family has traveled overseas to a country that perhaps has this disease circulating, and typically if everybody wants to bring back a souvenir, and typically people who were maybe born overseas miss some things that they can't get here, and sometimes sausages and smoked meats and things, they still make it back, and somehow wind up to the pigs if it's a smallholder, which you would hope they don't feed kitchen stuff, but it can happen. So sort of a list of things you can worry about if a lot's going on, and you probably would just want to make yourself aware, and like I said, we will have a video of what these things look like, but they're sort of your hit parade from CFIA, vesicular stomatitis, pseudorabies, African swine fever, classical swine fever, foot and mouth. I mean, you can get a headache worrying about it. And some of these things look like some of the pictures I showed you earlier. There's African swine fever, so there's a pig that's kind of hemorrhagic and red or spotty. Remember that spotted pig I showed you, like swine pox? Is it swine pox? Is it a circovirus infection? Well, you would have a lot of really sick pigs, and that's your first clue. And look at this pig up in the top left corner, hemorrhagic conjunctiva. The spleen has got, and I'll talk about this in the foreign animal disease section, but big infarcts on it, so it's your heads up. But just to confuse you more, I mean, you wouldn't have high mortality, but when circovirus first blew out back in 2004, 2005, we would see these splenic infarcts as well. And I can remember getting a call saying, we've sent this from the lab saying we've sent the spleen up to Ottawa. Want to rule out, classical swine fever, which was a worry at the, a worry because of what they'd seen. African swine fever wasn't on our radar at that point. And could you just tell everybody on the farm to stay home for the weekend? And so I called them up and said, we don't think it's really a problem, but we just want to make sure it's not a problem. And it turned out to be circovirus. But just to show you that in swine, many things look like many things. And I'm sure I've been really helpful telling you that. If you see blisters, we do have Seneca virus A. It resembles foot and mouth disease, but it's not. It just gives you blisters. It will give you lame pigs. If you see blisters, just call CFIA. Just call them and discuss it. And we'll have these numbers posted for you as well, but you don't have to write them down, but call CFIA. If you're seeing something really funky going on, give them a call. Don't take the postmortem yourself and send stuff off. Of course, we all know better. Just give them a ring and make sure you're not dealing with, if it is Seneca Valley virus, well, we'll work with it and it does go away, but we want to make sure it's not a foot and mouth. So there was a very rapid session of all things to think about when you're going to look at a herd of sick pigs, and or a sick pig or small diarrheic pigs or whatever. But hopefully I've taught you how to peel an onion, and you found this kind of useful. And if there's any questions, I'd be happy to answer them.
That's great, Sue. So we did have a few questions. And so the first one is, what needle size and needle lengths for blood collection with the ear vein and the jugular vein?
So ear vein, you're probably going to use a needle and syringe. And so, you can probably get away with a 20 gauge on a medium-sized pig. On a big pig, you might get an 18 in there, but if they move, you're kind of dinked. 21, 22 in the smaller pigs. And then jugular, I've always been bigger pigs. So what's a bigger pig, Sue? 25, 30 kilos, you can get away with an 18 gauge. Those little guys, I use a 21 gauge. Now, it takes longer to get the blood out, but I'm mindful of it's a little jugular vein, and I don't want to be stuffing an 18 gauge needle in there. I don't think that's fair. So I use a 21 gauge. I used to use 20 gauge 1.5 inch, but they're gone for some reason. So I like 1.5 inch. It gets a little more play in there, and you can kind of drive around looking for the jugular.
That's great. And speaking of jugular, Lori asked, any concern with left or right-sided jugular blood collection, and does it matter? Many textbook references talk about the association with the cranial vena cava.
I haven't had issues. I don't think any swine vet would say they've had issues. I don't get super low, you know, in the larger pig. And the smaller pig, you're going to find it really difficult if you try it. Like my average shot point, if you will, is halfway down the neck. And the smaller pigs, you really do have to go a little lower. The bigger pigs, yeah, halfway down the neck and aiming towards the opposite shoulder works quite nicely. And it's usually a really big jugular vein. The odd pig has got it. They decided to put it somewhere else and you'll struggle. But for the most part, 99% of the pigs, it's easy to do.
That's great. Fabrice asked, what would be the indications to avoid a viral disease in an endemic area? And then there's a second question, but I'll let you answer that one first.
So let's assume you know, PRRS, influenza, something like that. So PRRS certainly can be tracked around in the wintertime, or PED. Let's say PD. That's even better if we have PD in the neighborhood. And it all gets down to biosecurity. So that's next week. So tune in. We'll talk about biosecurity. But just having these guys be mindful of going in and out of the barn. So we'll talk about this next week, but basically you have outdoor boots and you go to the barn and you have indoor boots. And I realize the pigs may be going in and out, but it's where your boots have been and where you have been that can possibly track stuff in. The pig is sort of in the backyard of his pen or inside the barn. Some viruses like PRRS, mycoplasma is not a virus, but or influenza may be airborne if there's a big herd nearby and they're breaking with something. So that's more difficult to control. But I think just being mindful of biosecurity, you know, coming in and off the farm, in and out of the barn is really important.
That's great. Next question, when is it advisable to raise adult pigs mixed with piglets in the same environment? In the same angle, I wanted to ask, what would be the maximum number of pigs to raise to maximize the profitability of a piggery?
That's a huge question. So basically, you'll have the sow with her piglets. Let's start right at the beginning. And usually they're weaned 5-6 weeks, something like that. And then the sow goes back with the sows and the piglets to go with the piglets to kindergarten. And so they'll stay as that. It's preferable to keep the age groups together if possible, because if they're a big enough smallholder, they'll be changing their diet. So their dietary requirements change as they're growing. So their protein, you know, requirements at 4 weeks, let's say, is, you know, around 19-20%, and it drops down by the time you get to a finishing pig, you know, it can be 15%. So you want to stage the diet according to the pig. If you have them all together, it's really hard to stage that diet. Profitability, so feed is your biggest cost. So if you're going to cheap out on the pig on feed, he's going to cost you more. And I think that's the fairest way of putting that. If you make a ration that's designed for that size of pig and for raising pigs, and you have the right environment and your health concerns are minimal, that's your maximum profitability. And I know it's a little vague, but that's a big topic.
Okay. And the next question, what are the reasons for rectal prolapse in pigs and how can it be prevented?
Well, we'll start to get into that next week. Rectal prolapses can occur if there's a significant level of zearalenone, certainly in the feed. But that's a feed issue, but more than likely with a smallholder, you may have inappropriate environment. They're cold, there's not enough bedding, they're going to pile up, and the guy in the bottom has all that weight on top of him, and out comes his bum, and then we got to deal with that. Straining, sometimes salmonella, diarrhea, straining can cause a rectal prolapse as well. So there's rectal prolapse tube repair kits you can get, and you just sort of insert the tube into the bum, and there's like elastic type thing you put on the outside. So the outside of the bum falls off, and then the tube comes with that, and then the rest is all inside again. So it's pretty slick.
And then the next question is, can you reshare the slide on swine vesicular virus?
I can reshare that. is this one here was one we're talking about. There we are, the vesicle on the nose. We'll talk about this more. You'll see this, a whole selection of these kinds of slides with the, and I know I'm jumping ahead a little bit here, Doris, but there will be a recorded foreign animal diseases of pigs. So this is the only one I have here. It's subtle, but with Seneca Valley, you can certainly look it up online. There's tons of photos of images of swine with Seneca Valley, and it's basically any swine with vesicular lesions. Don't assume it's Seneca Valley. Make sure you call CFIA.
That's great. Anyone else with questions, feel free to unmute yourself now or just chat it in the chat box. So for Melissa, why would the older pigs in your case study start losing weight on the piglet feed, just running around too much from the extra protein and energy?
Yeah, so a pig will eat to meet its energy requirements and they'll stop. So we had a high energy dense feed. So they would eat so much and say I'm full. I've met my caloric requirement for the day. And plus the protein was so high. So it was a really hot diet. And if you have an unbalanced diet with pigs, they're frustrated, they get annoyed, they'll tail bite, they'll beat each other up. It looks like a behavioral issue, but what you want to really focus on, as I said, when I was talking about these guilts as well and beating each other up, behavioral issues, I start looking at feed. In fact, I forgot to tell you about the guilt story. So they were on a hot diet as well. And I recommended that we drop back down. So we have what we call a guilt developer diet. And I recommended we drop back down to a basic hog diet, which was a less dense diet, just to slow them down a little bit because they were clearly not happy with what they were getting.
I think that's it for questions. We have 8 minutes left, so feel free to unmute yourself now, or otherwise we could maybe, Sue, if you don't mind briefly talking about next week's session.
So next week, we're going to be talking about biosecurity and different pig procedures, which will include addressing the rectal prolapse question, which was excellent. Thank you. So we'll be going through vaccinations, sort of a bit more of a grab bag session. But, so now that you're sort of familiar with normal pigs and we're looking at disease pigs, and now we're looking at keeping disease out and also working with some problems in pigs. And I think that'll be hopefully equally as interesting.
That's great. Thanks. Also, I just wanted to remind everyone the Zoom link that you had for your original registration, that's the same Zoom link for all 4 courses. So just keep that with you, and that'll just be for the next course as well as the last week as well. You should have also received 3 documents as PDF files from me. If you haven't, just email me and I could send that to you before next week. So one more question. How do you work with a producer if they've been found non-compliant with humane transportation to abattoir?
Well, certainly humane transportation is a federal regulation. So the transportation of livestock is a CFIA health of animal statute. And so they're required by law to provide humane transportation. So having the discussion, certainly Ontario Pork has resources online. You can go look up there. If the producer is somewhat reluctant to embrace the information, contact Ontario Pork and they can have somebody come out and talk to him about how to do it right. I mean, I think sometimes it's just people don't realize that, the regulations have changed over the years, and they may be sort of stuck in older ones, and bringing them up to speed just maybe require just a discussion with them yourself. And like I said, if it's and showing them the resources online, and if that's not really helping, or not, I shouldn't say Ontario Pork, but any of your pork commodity groups across Canada, I keep forgetting, this is Canada-wide. So they're really good to work with. So don't forget them, because they have a lot of things that can help you in these situations.
I think one more question. So do you have any good nutrition resources? So when you are new and looking at a ration, we have a chance at seeing something wrong rather than blankly staring and just being frustrated?
Well, you know what? Call a nutritionist at a feed company. because like we do vet stuff and they do feed stuff. So get a, the feed companies are all really good to work with. I mean, you can get a basic breakdown. You can go online, you can look at, feed requirements of swine and whatnot. I have tomes on nutritional requirements of swine, which are forever getting updated on me. And so I think cut to the chase, we're busy people. Call the nutritionist at the feed company and say, hey, I'm looking at this. I don't even know what I'm looking at. And they will be happy to help you out because they're specialists.
One more question from Jen. I'm a small producer. I would really like to understand the pathophysiology of the different diseases. Are there textbooks you would recommend?
Well, sure. Diseases of swine. Start right there. It's an excellent, it's my reference text that I use. There's probably other ones out there as well, but I think, I'm just staring up above me at my giant library of things, and I suppose you could do pathology of domestic animals, but that's everybody. So I would stick with diseases of swine. That's my Bible, and every time there's a new one, I get a new one because they update themselves every 8 or 10 years, and they're also loaded with references. So if you wanted to pursue something further, you can certainly go through the end of the chapter and chase more information down.
That's great. Okay, so we have 4 minutes left. Any other burning questions? Feel free to unmute yourself or chat it in the chat box. All right, looks like we don't have any, so I guess we'll see everyone next Tuesday then. Same link and same time. Thanks so much. Have a
Excellent.
good night.
Thank you.
Thanks, Sue. Bye. Bye, everyone.
Bye.